The spleen meridian of foot Tai Yin has 21 points and it begins at the big toe on the medial side. We draw a line from the base of the nail and also a line on the vertical line at the corner of nail, and this should be 0.1 chun to the corner of nail on the medial aspect. And that is spleen 1. Spleen 1, yin bai. Okay. Spleen 2, da du, is on the medial aspect of the great toe again, but on the anterior border of the first metatarsal bone. So just there. Spleen 3, tai bai, is on the posterior border of the head of the metatarsal bone, so it's on the opposite side. Spleen 4, gung sun, is anterior and inferior to the base of the first metatarsal and at the junction of the red and white skin. So if we can just feel off the base of the first metatarsal there, and that's where it is, and the red and white skin is an imaginary section of the skin there. Spleen 5, shang qiu, is in the depression anterior and inferior to the medial malleolus. So we go anterior and inferior, and it's actually very close to liver 4. Spleen 6, san yin jiao, is 3 chun above the medial malleolus. To find this point, we can go 15 chun, is between the medial epicondyle and the medial malleolus. And if we divide that into thirds, that's 5 chun, and we can count into 5 sections. Okay. Spleen 7, lo gu, is 3 chun above spleen 6, so that would be 12 chun between the medial epicondyle and spleen 6, and if we divide that into half, and then half again would be 3 chun above. And it's on the medial aspect of the tibia. Spleen 8, dizi, is 3 chun below yin ling chuan. So yin ling chuan spleen 9 is just found as we curve on the border of the head of the tibia and just where we curve. So if you bring your hand along the tibia, and as we're curving, you'll see that it's very close to, and 1 chun behind is liver 7. Okay, so if we have spleen 9 there, and we need to find 3 chun below, then we have between spleen 9 and the medial malleolus is 13 chun. If we halve that, that's 6.5, 3 1/4, and if we just go a little bit above, then that should be 3 chun, and again on the medial aspect of the tibia. We found spleen 9 before. To find spleen 10, we have the leg adjusted up. Spleen 10, we find the point with the knee flexed. When the knee is flexed, the medial epicondyle becomes level with the superior border of the patella. We still locate this as 18 chun between the pubic symphysis and the superior medial border of the patella. If we go thirds, that's 6 chun, and thirds again, that's 2 chun above. Another way to locate this point is to, if your hand is similar to the patient's, then we can put the base of your hand at the base of the patella and having your thumb at a 45-degree angle to your index finger, and the point should be where your thumb lands. But of course, Conan's hands are much bigger than mine, so it should be around that location there at 45-degree angle. Okay. To find spleen 11, we have to find spleen 12 first, because there's a line joining between spleen 10 and spleen 12. To find spleen 12, which is 3.5 chun lateral to the midline and level with the border of the pubic symphysis. To find 3.5 chun, we find rectus abdominis, which is 4 chun. We halve that. That's 2 chun. Half again is 1 chun, and another half is 3.5 chun. And then find the level of the pubic symphysis, and it should be lateral to the femoral artery. All right, from spleen 12 and level with spleen 10 is spleen 11, 6 chun above spleen 10. Here we have spleen 10 was already 2 chun above, and therefore at the pubic symphysis level we have 16 chun. So half that again is 8 chun, another half is 4 chun, another half is 6 chun in the line drawn. We've already found spleen 12. And spleen 13 is 0.7 chun superior lateral to spleen 12 in the inguinal region. So we go 0.7 chun above and lateral, or we can also use 4 chun lateral, but it needs to be 0.7 superior lateral. Okay. And that's spleen 13. Spleen 14 fujie is 3 chun above spleen 13 or 1.3 chun below spleen 15 daheng. And daheng is 4 chun lateral to the midpoint of the umbilicus, which is at abdominis rectus. And we go 1.3 chun below, therefore we can use pubic symphysis as a margin, and the middle of the umbilicus is 5 chun, and divide it into fifths. One fifth below is 1 chun, and then we go to the bottom 1/3, and that is 1.3 chun below. We've found spleen 15. Spleen 16 full eye is 3 chun above spleen 15 and 4 chun lateral. So to find 3 chun above, we find the xiphoid-sonal angle, and the midpoint of the umbilicus is 8 chun. 4 chun lateral is level with the nipple, and we need to find 3 chun above spleen 15. So if that is 8 chun, that is 4, that is 2, and that is 1, and it should be right at the margin of the costal angle. And that is spleen 16 full eye. Spleen 17 shudou is in the 5th intercostal space and 6 chun lateral to the Ren meridian. To find 6 chun lateral to the Ren meridian, we can use the sternal notch and the acromio process as 8, halfway is 4, and another half is 6, but we also have to follow along the line of the chest. The other way to find 6 chun is between the nipple and the mid-axillary line is 4 chun, and then halfway is 6 chun. In the 5th intercostal space, therefore, we need to locate the 5th intercostal, starting from the 11th rib. Just above should be the 10th intercostal, 9, 8, 7, 6, and 5. And in that line at the 6th intercostal. Spleen 18 is again 6 chun lateral to the Ren meridian in the 4th intercostal space. So we should just go above into the next intercostal, and you should be level with the nipple. Spleen 19 is in the 3rd intercostal, and we're following the chest at the 6th intercostal, 6 chun lateral, beg your pardon. So let's just do our 6, and here we are in the 3rd intercostal. Spleen 20 is in the 2nd intercostal space and 6 chun lateral, and we should be more on the anterior aspect of the chest as now. And just to confirm, 1 and into the 2nd intercostal. The last point, spleen 21 dabao, is on the mid-axillary line in the 6th intercostal space. So we have the mid-axillary line along here, using the 11th rib and the axilla as a line drawn as the mid-axillary line, and again locating the 6th intercostal space. We find the 11th rib. There we are. That's the 10th intercostal, 9, 8, 7, and 6, and we need to move back toward the mid-axillary line. And there we have it. Spleen 21 Daba.